Welcome to Journey to 600.
Today we're talking about metabolic disorders, specifically that affect cortisol and thyroid hormone. So we'll break it down with just cortisol, dealing with the adrenal gland, which is Cushing syndrome and Addison's disease. Then we'll move to the thyroid gland and talk about Graves' disease and Hashimoto's disease, and then do a little summary and compare them. Starting us off, Cushing syndrome. So the pituitary gland produces excessive ACTH, which is the adrenocorticotropic hormone. Therefore, excessive cortisol is produced, and that is what Cushing syndrome is. It is characterized by fatigue, proximal muscle weakness, weight gain, moon face, buffalo hump, hypertension, high blood sugar, and bradycardia. Treatment includes pharmacological intervention to block the production of hormones, radiation therapy, chemotherapy, or surgery. So you can see the picture. This is what someone might look like that has Cushing syndrome. Really characteristic, that moon face, buffalo hump, and then some complaints of muscle weakness and fatigue. Next is Addison's disease. This occurs when the adrenal cortex produces insufficient cortisol and aldosterone hormones. It is also characterized by fatigue and proximal muscle weakness. But in this, you'll see weight loss, skin hyperpigmentation, GI issues, hypotension, low blood sugar, and tachycardia. Treatment primarily consists of long-term pharmacological intervention using synthetic corticosteroids and mineralocorticoids. So those are the two for adrenal gland. Next is Graves' disease. Graves' disease is the most specific cause of hyperthyroidism. It is most common in women over 20 years old. It is an autoimmune disease in which certain antibodies produced by the immune system stimulate the thyroid gland, causing it to become overactive. It also has fatigue, proximal muscle weakness, again, some weight loss, but characteristically, it's going to have some heat intolerance, exophthalmosis, which is protruding eyes, hyperreflexia, hypotension, and tachycardia. Treatment includes pharmacological intervention and or removal of the thyroid gland using radiation or surgical intervention. Next is Hashimoto's disease. So this is an autoimmune disorder affecting the thyroid gland where the thyroid gland no longer produces thyroid hormone, leading to a low thyroid hormone in the body. It is most common among middle-aged women. It is characterized by fatigue, proximal muscle weakness, weight gain, cold intolerance, dependent edema, hyporeflexia, bradycardia, and constipation. Treatment includes oral thyroid hormone replacement therapy. So in summary, all these syndromes have fatigue and proximal muscle weakness, but let's highlight some major differences. So on the left of this table or chart is cortisol issues. On the right is thyroid. The top two, Cushing's and Graves, are when there's high cortisol or high thyroid. And on the bottom is when you have low cortisol or low thyroid. So as you can see, Cushing's and Hashimoto's are more of a weight gain, but Graves and Addison's more of a weight loss. And then between Graves and Hashimoto's, Graves you're going to have those protruding eyes and hyperreflexia and heat intolerance, but Hashimoto's you're going to have cold intolerance, hyperreflexia. Between Cushing's and Addison's, looking at that moon face, buffalo hump, like that's going to be the most characteristic of Cushing's. But with Addison's, it's going to be more the skin hyperpigmentation. But they do have differences in their blood pressure, blood sugar, and heart rate between Cushing's and Addison's. Time for practice questions. So a patient reports fatigue and extreme weight loss. During your examination process, you note proximal weakness, skin hyperpigmentation, low blood pressure, and a 2+ patellar reflex. Which of the following is the likely cause of this patient's symptoms? A. Hashimoto's disease. B. Graves' disease. C. Addison's disease. D. Cushing syndrome. I'll give you a moment to answer. If you're not ready to go over the answers, please pause. So, going back through this question, the patient has a low blood pressure, which is seen in both Addison's and Graves' disease. A 2+ is on the deep tendon reflex scale. That is a normal response. So it is saying this person has normal deep tendon reflexes. So we can rule out Graves' disease since it is typically hyperreflexive. And you can also rule out Hashimoto since it's typically hyporeflexive. Thinking about skin hyperpigmentation, that is a clear indication for Addison's disease. So the correct answer is C, Addison's disease. Also, Cushing's has high blood pressure, but in our information it says low blood pressure, so that is the reason we can rule out Cushing syndrome. So C is the best answer, Addison's disease. Practice question number 2. A patient reports fatigue, extreme weight loss, and an inability to tolerate hot temperatures. During your examination process, you note proximal weakness, protruding eyes, hypotension, and 3+ Achilles reflex. Which of the following is the likely cause of this patient's symptoms? A. Decreased production of cortisol. B. Hyperfunction of the thyroid gland. C. Hypofunction of the adrenal cortex. D. Hyperfunction of the adrenal cortex. I'll give you a moment to answer. If you're not ready to go over the answers, please pause. So let's call out the important things from this question. Heat intolerance, protruding eyes, hypotension, and then 3+ Achilles reflex means it's hyperreflexive. So this is Graves' disease, which is due to hyperfunction of the thyroid gland. So B is the best answer. A and C are actually saying the same thing, hypofunction of the adrenal cortex. So the adrenal cortex does make cortisol, which would mean decreased production of cortisol. And then just from looking at the answers, you might have guessed C or D due to the answers being opposite of hypo versus hyperfunction in the adrenal cortex. But remember, when you see heat or cold intolerance, it will be related to the thyroid gland. And out of all these answers, there's only one answer related to the thyroid gland, and it is hyperfunction of the thyroid gland, which is typically Graves' disease. Thanks so much for watching.
Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.